Question 1. Promoting good work and improved health and wellbeing outcomes for children and young people by contributing to prevention and reducing health inequalities is at the heart of school nursing. Does this fit with your wider vision for the wider public health nursing workforce?
Oh, it definitely does. We're doing a lot of work nationally on how we can best describe the huge contribution that nurses and midwives make to improving and protecting the public's health. And it's something we've not been very good at in the past. We don't have a strong literature around it. We don't have a model that makes it easy for people to see where their contribution is. And we haven't necessarily invested heavily in the right kind of programs and tools so people can make the most of that. So what we're doing, and many school nurses have already been involved in this work with us, is to develop a national model for the nurses' contribution to public health that makes it easier to do all those things and above all really raises the visibility and the importance of the work that practitioners like school nurses do. And of course we now have the public health outcomes framework where we look, which is a way of measuring the kind of impact that these things have, and we've done a lot of work actually showing where the contribution of practitioners like school nurses and health visitors impacts on the public health outcomes framework. So absolutely fits with the work we're doing and more than that, absolutely a key part of that work.
Much emphasis has recently been placed on the leadership role of school nurses. Can you outline why you feel this is important and what benefits this might bring?
So to follow on the conversation about the model, we look at the contribution of nurses and midwives at 3 levels, and these are additional, so you do all of them by the time you get to the top of our pyramid. So the first level is the contribution that all nurses and midwives and care staff and others can make. And it's things like making every contact count, really having health and wellbeing in your mind when you do your job. The second level is around nurses who have a role in both individual treatment and a very strong prevention role, and some kind of role for groups wider than a one-on-one contact. And that might be people like sexual health nurses or TB nurses or practice nurses. And the third level are the groups of nurses who specialise in population health. They're nurses whose job is to improve and protect the health of groups of people and communities. And at that level, we have practitioners like specialist public health practitioners, health visitors, and of course school nurses. And one of the opportunities and responsibilities of being at that top level is the leadership role. And I see that as 3 kind of things to be done really. One is role modelling the kind of things we want, the prevention and the good health advice. The second is to be a real champion for the culture change that we need about health and wellbeing. And the third is local leadership. And school nurses are leaders of health promotion and protecting health within their schools and within the wider community for children and young people of school age. And I think there's a huge potential. So some of the work that we've done recently, for example, on young carers and school nurses leading the support programmes for young carers would be an example of how that might actually be in practice.
Great. Specialist community public health nursing postgrad courses are now including modules on business management for nurses. Do you consider this to be relevant for school nurses?
I do. I consider it to be relevant actually for any nurse who's going to be in a senior leadership position. And when we were doing the National Nursing Strategy, Compassion in Practice, we specifically talked about care as our business. Care is what we do, but it needs to be set in an understanding of the business that you're operating in. And I think it's really important. I think it gives people confidence to have conversations with managers and with commissioners and be able, if you like, to sell their service and what it can achieve. And I think it starts to give people the skills that when they've got a really good idea, they can work it up into a business model and share that with people and get investment into the service to take those ideas forward. So yes, I do think it's entirely appropriate to have in those kind of programmes.
Children, young people and their parents tell us that they want us to be more visible, accessible and offer more confidential services. However, like many, the profession is creaking under the strain, so we need to find leaner and more efficient ways forward. Do you feel social media has a part to play by delivering services? Can it really be a successful medium for healthcare delivery for children and young people?
It's a really fascinating topic, isn't it? And actually a very topical topic, because only this week discussions about accessing your general practitioner by Skype have been in the news. So I think it's the world we live in. And when we spoke to children and young people, when we were developing the school nurse development programme, they were very, very clear about this is their world. They said things like step into our world, and they said things like get in sync with our lives, and things like one of the best productivity quotes I use a lot came from some children and young people, was in response to we don't have time to provide everything you'd like, was stop doing stuff in stupid ways then, by which they meant you're not using technology well enough, you're not doing things that would help you to free up some time. Now, I'm not for one moment saying that that would be enough, and I'm not even saying that the primary driver for that is efficiency or productivity, although that is hugely important. I think the primary driver is the connection, and the fact that children and young people themselves said they wanted this connection in these ways is really, really important. And when you look at the kind of things they ask for, they're the kind of things actually that we all use in everyday life. Text me to remind me if I've got an appointment. Direct me to a website where I can understand the immunisation programme that you're offering to me. Don't give me a leaflet, give me an app. And I think that those things are the way that we will increasingly be expected to deliver healthcare, and probably especially to children and young people. As at a meeting the other day when they were bemoaning the fact that we'd have to use email because it's so slow. And certainly now, talking to my own children who live abroad, email's too slow, it's instant message, it's Skype. So I think we do have to really embrace that. And I think one of the other things while I'm on social media is a request to you at conference to tweet the conference, and I'll be looking at your tweets to follow the conference. And Sharon from SAFNA and I used Twitter a lot to share messages about public health, about children's health and about school nursing, so I would urge you all to use this medium where you can.
Excellent, that's very interesting. Not that everything else wasn't. The Department of Health School Nurse Development Programme is indeed raising the profile of the profession and providing valuable frameworks, pathways and tools which are helping influence and reshape services. Is there an ongoing commitment to this programme of work?
Well, the short answer to that is yes. I have the privilege, as I said at the beginning, of being the professional lead for school nursing across Department of Health, Public Health England. Both the department in policy terms absolutely recognise the importance of school nursing as a central driver to improve health in the school years, and Public Health England has the job of taking forward the support to local areas to make sure that we provide information for commissioners and indeed for practitioners themselves that allows us to get the best service out to those young people. So short answer, yes. Longer answer, as I've just given.
Most school nurses have seen a drastic increase in their involvement in safeguarding of children and young people. Much of this is in a reactive rather than proactive way. How can school nurses best work with partners to help protect children in a more preventative way?
I think it's a really key question, and when I'm talking to school nurses and when I'm out on school nursing visits, it's one that often comes up. So I'll sort of answer it in two parts. I think first of all, nationally, the interest in early intervention is increasing. We have an early intervention foundation. Public Health England's identified early intervention as one of the key prevention streams of its work on children and young people. We need to make sure that when we talk about early intervention, we talk about early intervention across all ages of children and young people, not simply for preschool, where most of the early emphasis has been. So I think the whole discussion about intervening early, making sure that people have the skills to support people at an early stage is really, really important, and that's how we take it forward at national level. Locally, on the visits I've done, I've been really impressed by the work that school nurses and their managers have done to think about how you can understand the needs of a school population. I was in London when some Year 10 girls were talking to the school nurse lead about what might help Year 8 girls to deal with some of the stress that they were under and to safeguard their well-being in the school. in terms of formal safeguarding procedures and requirement to attend case conferences, a lot of areas I've been to have had some really, really constructive discussions with case conference chairs and the local safeguarding board about when it is and isn't appropriate for a school nurse to be expected to attend those kind of meetings and how it can be made meaningful, because I think the big concern for school nurses is they were at times required to attend case conferences where they felt they had no real input that was of value to the child and the family going forward. So the work that's being done around making sure that the input is effective, I think is really, really important.
What about just a little aside here, just a question of my own then. Do you see a role for school nurses within a multi-agency environment, and how would they fit into that environment?
Oh, definitely. And I think increasingly school nurses are working with school-age children, not just in the school. And within the school, the multidisciplinary team is really important. So working with educational psychologists or SENCOs or whoever, it forms a really important multidisciplinary team. Out with the school, working with youth workers, social workers, mental health workers is really, really important. And that's important at all levels of the school nurse offer, universal health services through to specific multi-agency safeguarding programmes, which we call Universal Partnership Plus, so definitely.
The significant changes to the childhood immunisation programme will place huge demands on school nursing services. What steps are being taken to ensure a safe, competent, trained workforce are able to deliver on this agenda?
I think this is a really, really big opportunity, and we're having a lot of discussions. We have support nationally to really look at this as how we strengthen the school nurse's role in health protection. And if we think of the context we're working, immunisation becomes even more important as we're in an age of antimicrobial resistance. So protecting becomes even more important. School nurses have a great opportunity, given the capacity, to really build this into the work that they do, educating young people about AMR, about how to stay healthy, educating and providing immunisation programmes that have very high uptake is all really, really important. So as we look at the resource that's available to deliver the new immunisation programmes, then the role of school nurses and the resources needed to do that is a very important consideration. In terms of the specific training and development, we listen a lot to school nurses around what they say they need, and we'll be working with Health Education England to provide access to the appropriate training. And I think it's if we think of it in the context of health protection, we're going to need training at all sorts of levels. Fully qualified school nurses are going to be the leaders of this health protection programme, as we discussed earlier in this conversation. And what additional information do they need? Qualified nurses working within school health teams will be the people who will often oversee the vaccination session or give the vaccines. Childhood flu is the new one, that's a nasal spray. We need to think about a new way of working, because that can be self-administered by older children. What's the supervisory role, and what kind of training would RNs and healthcare assistants in the school nurse team need to undertake that supervisory role, so that the programme can be given safely and effectively. So I think it's a challenge for us nationally to get the resources in the right place and to get the training in place in time. I think it's a leadership challenge locally for school nurses to really use this opportunity to think about how they can have a higher profile around health protection in the school age years. I am a glass half full person. I think this is a great opportunity.
Great. School nursing welcome the increased investment in health visiting, FNP and other early preventative initiatives. School nursing is seeing nominal increases in investment. Are there plans to strengthen the school nursing workforce further?
The health visiting and FNP programmes were very unusual programmes in that they were directly nationally funded. Money went out indirectly, but essentially that was what happened. But for all other services, the level of investment is a local commissioning decision. We think that investing in school nursing is really important. The commissioners of school nursing are local authorities. Local authorities have told us the kind of information they need to make decisions about the investment in school nursing. I was on a visit the other day where the local authority really saw the potential of school nursing and actually had increased that investment. So nationally what we've tried to do is to produce the kind of information on which commissioners can make those kind of decisions. To work with directors of public health will be the people advising that process. So we've produced fact sheets for elected members so that they understand the role of school nursing. We've produced commissioning guidance, and now at the request of the Local Government Association we're doing work on a standard school nurse specification. So through those routes and through part of our earlier conversation about school nurses having a model in which they can be very visible and the kind of business skills to be able to have those informed conversations with commissioners, we will be seeking to drive this through local commissioning. I think the health and wellbeing boards will be really, really important in looking at the whole health needs of a local community, and particularly from our point of view, we're working with health and wellbeing boards to think about the healthcare needs of the children and young people in their area and the kind of response they need to make to those needs. And I think it's really, really important that school nurses get engaged in those kind of discussions with their directors of public health around what they see and what they find out in local schools to inform the health needs analysis and what they can offer to then respond to that.
What is your vision for the future of the school nursing profession? Nice big question to answer.
As lead nurse for public health, my vision is that all nurses and midwives will be given the skills, knowledge and enthusiasm to really do their bit around making every contact count to make a difference to people's health and well-being, whether that's advising on lifestyle changes people want to make or whether that's promoting immunisation. So I think that, as I said before, I really see our specialist community public health nurses as leaders of that change. So my vision would be a strengthened school nursing service with very clear recognition for the work they do around protecting and improving the health of children and young people, a service which is for the school years, not always in the school place, but in the place where children and young people want it to be, a service that joins up lots of elements of children's life and is the link between health, family and education services, and as we were saying, a service which is at the leading edge of doing things in different ways through some of the social media and new media approaches that children and young people have told us they want. But above all, what did young people say they wanted? They said they wanted a visible and accessible and confidential service. So I think whatever we do and however we design local services, if we keep that at the heart of it, then we really will see a vibrant nursing presence in the health of school-aged children and young people as we go forward.
Great, thank you. One last question, and that is, could we do the beginning again?
Okay.
Just because you're more relaxed now,
Okay.
it feels a bit more natural. One other thing, and that is, would you want to just tell people a bit about how you got to where you are? I don't know, I just think maybe that would be quite an interesting thing for a lot of these nurses sitting in the...
Can do.
Yeah?
Yeah.
See what you think when it's done.
Okay.
If you just tell us what you... so tell us, introduce yourself and what you do, and then just informally just tell us a bit about yourself.
Okay. Good morning everybody, my name's Viv Bennett and I'm Director of Nursing at the Department of Health and Public Health England. I hope that you have a great conference. I'm really, really sorry I can't be there in person. I won't bore you with the reasons why, but they're good reasons. I won't say that. Let me start again.
That was quite good.
Good morning everybody, my name's Viv Bennett and I'm Director of Nursing at the Department of Health and Public Health England. As such, I have the privilege of being the professional lead for public health nurses, including, very importantly, school nurses. I am very sorry that
It's funny how this bit is the bit that...
I am really sorry that I can't join you at your conference this year. I've thoroughly enjoyed it on previous years. I'm actually out of the country selling our vision for public health nursing to other chief nurses within Europe, which is, I hope a good reason why this is recorded rather than in person. I have been asked to tell you a bit about me. I'll keep it short, you'll be pleased to know. I trained in Oxford a very long time ago, and during my training I got very interested in the health of children and families, and I chose, after completion of my training, to work on a children's ward, which I did for about a year, and I did a children's medical ward and paediatric intensive care. And increasingly I noticed that as well as children who were very sick with conditions that weren't preventable, we had a lot of children who were very sick with conditions that were. Things like, at the time, there was a great deal of nervousness about pertussis vaccine. We had some very, very sick children in with whooping cough. We had children who'd had accidents that would have been preventable, with more advice into the home about home safety, particularly where the housing was of poor quality. And I guess that's what raised my interest in public health nursing. So I trained as a health visitor quite soon after qualifying, and worked in health visiting research for a long time, and worked very closely with school nurses, and was really convinced then, as I am now, that this continuum from pregnancy to 19 is vital for a healthy start in life and to life chances, and that nurses have a huge amount to offer to that. And then I did various jobs as a director of nursing, or a director of change and redesign, or various other posts, and in all of them I kept the lead for work with children, young people and families. So it's been like the continuing thread through my career. And when I first went to the Department of Health, I think it was 6 years ago, one of the things that really excited me about the job was the portfolio was all about public health and child health. And in my new role now, I have the professional lead for health team and school nursing, the lead at DH for policy on children's public health nursing, and I'm chair of the corporate board for Public Health England that specialises in children. So that resume is, I guess, intended to show you that my commitment to doing everything that we as public health nurses can do to improve health outcome and life chances for children and young people is very real and very sustained.